Welcome back to the Deep Dive. Today we're really digging into a big one. Executive Order 12187, signed back in January 2025.
Right.
And, our mission here is just straightforward policy analysis. What's in it? How does it work?
And what actually happened because of it? The real world stuff.
Exactly. The seismic shifts in healthcare.
Yeah. And it's important to see EO 14187, the one titled Protecting Children from Chemical and Surgical Mutilation, wasn't really a standalone thing.
Okay. Part of a bigger picture then.
Definitely. It came alongside others, like 14168. That was the Defending Women from Gender Ideology Extremism one.
Right, I remember that.
And also 14183, which was about prioritizing military excellence and readiness. So you see, there's a kind of pattern.
When you stack them up like that,
Yeah.
the relevance for you listening, it just becomes really clear.
Mm-hmm.
The federal government is basically positioning itself against a whole range of gender-related therapies.
And when the world's largest healthcare payer takes a position like that.
It changes things.
Yeah.
Fast.
Oh.
Across the board. Okay, let's unpack the actual core policy here. What does it say?
So Section 1 lays it out pretty clearly. It states the U.S. government won't fund, sponsor, promote, assist, or support what it calls the so-called transition of a child from one sex to another.
And the target group is specific.
Yes, specifically individuals under 19 years old.
Now, reading the order itself, the language just jumps out. Yeah. It's unusually, a motive for a federal order, isn't it?
It really is. Not the typical dry legalese. It uses terms like chemical and surgical mutilation, maiming, sterilizing.
That's strong stuff. It signals intent pretty clearly.
Absolutely. And it goes further, mentioning a horrifying tragedy, warning about impacts on future fertility, ability to breastfeed. It's forceful language, definitely framing the administration's view right there in the policy text.
So with that framing, how does the order technically define chemical and surgical mutilation? What procedures are we talking about?
Section 2 gives the definition, and it does note this is sometimes called gender-affirming care. It lists three main things. First, puberty blockers, the GnRH agonists use to pause puberty.
Right.
Second, using sex hormones like androgen blockers, estrogen, testosterone to change physical characteristics. And third, any surgical procedures aiming to alter or remove sexual organs.
And it seems like the order doesn't just stop the care. It actively goes after the medical guidance supporting it.
That's right. That's Section 3. It's quite direct. It tells federal agencies to stop using guidance from WPATH.
WPATH being the World Professional Association for Transgender Health.
Exactly. The main international body setting standards in this area for a long time. The EO actually calls their guidance junk science.
Oh, wow, junk science.
Yeah, and it immediately tasked HHS, the Department of Health and Human Services, to publish its own review of the literature on best practices within 90 days.
So not just defunding, but actively discrediting the established medical consensus. That must send ripples through the medical community.
It certainly creates immediate tension. Agencies are basically told to ignore the existing clinical standards, which brings us to the next big question.
How do they actually make this happen? How does the executive branch enforce something this sweeping?
It's not just a statement of principle. It's backed by some serious mechanisms, mainly financial ones.
Right. The federal funding levers, what are the big ones?
They're huge, as analyses pointed out pretty quickly. The administration uses federal money as a kind of hammer. Section 4, for example, hits research and education grants.
So universities, teaching hospitals.
Precisely. Institutions getting those federal grants have to ensure they stop providing these procedures to minors if they don't comply.
They risk losing that funding, which can be massive.
Exactly. Then you add in Medicare and Medicaid.
The biggest payers.
Right. Section 5 directs HHS to use regulations to stop care funded through those programs. It involves reviewing eligibility, but also looking at Section 1557 of the Affordable Care Act.
That's the anti-discrimination part of the ACA?
Yeah. The idea seemed to be to reinterpret or limit how that applies here.
Okay, so research grants, Medicare, Medicaid, what else? Federal employees too.
Yep, Section 7 goes there. It targets the health plans for federal workers, FEHB, and the Postal Service one, PSHB.
Okay.
OPM, the Office of Personnel Management, was told to basically write coverage for pediatric surgeries and hormones out of those plans for 2026. Millions of workers affected.
So the strategy is basically cut off the money. But there's more to it, right? A legal angle, the DOJ.
There is. Section 8 brings in the Department of Justice, and this is where it gets particularly interesting regarding federal reach.
How so?
The Attorney General gets two main priorities. First, investigate fraud related to these treatments, specifically deception about long-term side effects, under the Food, Drug, and Cosmetic Act.
Okay, that seems somewhat standard, maybe?
Perhaps, but the second one is more novel. The DOJ is told to prioritize action against so-called sanctuary states.
Sanctuary states. In what context?
States that, according to the EO, help strip custody from parents who support what the order calls healthy development, essentially. Parents resisting transition for their child.
Wait, the federal DOJ getting involved in state-level child custody disputes? That feels like a major overstep, doesn't it?
It certainly pushes boundaries. It's traditionally a state domain, so you have this combination. Financial threats plus this new investigative pressure. And the reaction from hospitals was, well, immediate.
Chaos, I imagine.
Pretty much. A lot of major hospitals like Children's National, NYU Langone, they quickly announced pauses. Said they needed to figure out compliance.
And we saw that scope creep issue too, right? Where the pauses went beyond just minors.
We did. That was a key finding in some analyses, like Memorial Health in Georgia canceling surgeries for adults in their 20s.
Wow.
Or primary healthcare in Iowa stopping all gender-affirming care, even for adults, though the EAO only mentioned under 19s.
That shows a level of uncertainty and maybe fear.
Absolutely. And the Children's Hospital Los Angeles case, CHLA, that really highlights the pressure.
What happened there?
They initially paused care for minors. Then California's Attorney General warned them that might violate state law.
Okay, so they resumed.
They did, temporarily. But then, not long after, they announced the whole gender clinic was closing permanently.
Permanently? Why?
They explicitly cited the federal pressure. They even stated publicly that CHLA relies on federal funding more than any other pediatric hospital in the state.
So the financial leverage worked, despite the state pushback.
In that case, yes. But not everywhere. Some providers, like TransHealth in Massachusetts, Howard Brown in Illinois, they said, nope, we're continuing care.
Which naturally leads straight to the court.
Instantly. And this is where the limits of executive power really get tested, especially without Congress acting. Legal experts like Alana Redfield pointed out, executive orders aren't laws passed by Congress.
Right.
The question became, does the president actually have the authority from Congress to do a lot of what this order mandated?
And the courts weighed in.
They did. Two major injunctions quickly followed. First, PFLAV v. Trump. That resulted in a temporary nationwide block from Judge Herson.
Nationwide? Blocking what exactly?
Specifically blocking the government from withholding federal funds from hospitals providing this care to minors while the case proceeds.
Okay, so protecting the funding. For now.
Right. Then, separately, 4 states, Washington, Minnesota, Oregon, Colorado, sued together.
Okay.
They got a block in the executive order, too, but it only applies within those 4 states.
So a bit of a patchwork legal landscape.
Very much so. And you had 15 state attorneys general put out a joint statement saying they were committed to ensuring care continued, pointing to that PFLAJ ruling protecting the funds.
Makes implementing the ego really tricky then. Depends where you are.
Exactly. And we should also remember the backdrop here, the established medical view.
Right, the major medical associations.
They largely continue to support access to this kind of care for minors when appropriate. And just for scale, there was a JAMA pediatrics study. It found that fewer than 0.1% of adolescents with private insurance are actually transgender or gender diverse and receiving puberty blockers or hormones. So the number directly impacted by the immediate policy shift, while significant for them, is a small fraction overall.
Okay, so let's try to synthesize this. We've gone through the policy, the enforcement, the fallout. What's the big picture from this deep dive?
Well, EO 44187 is clearly a very broad attempt to use the federal government's financial power through grants, Medicare, federal insurance to force a specific nationwide policy change on medical care for minors.
Why?
But its actual rollout has been messy. It caused a lot of immediate friction, forcing hospitals into tough choices between money and medical practice or state laws. And crucially, those financial threats, the main enforcement tool, are currently tangled up in court.
So for you listening, what this really shows is how a major federal policy move can create huge waves, lots of legal battles, and real uncertainty for providers and patients on the ground. The availability of care gets impacted no matter how the lawsuits ultimately shake out.
Right. And it leaves us with a pretty fundamental question, especially given the lawsuits from states arguing this whole thing, particularly the DOJ investigations, is basically an attempt at an unlawful national ban.
Yeah.
To what extent can the executive branch use these kinds of threats, pulling funds, launching investigations, to push through a policy agenda when Congress hasn't explicitly legislated it? That's something to keep thinking about as these legal fights continue.
A really key question. Thank you for joining us for this deep dive. Keep exploring how policy shapes our world. Let's do it again soon.